Hi, this is Dr. Robert Brueck coming to you again from Southwest Florida with a new segment, What's New in Cosmetic Surgery. Today we're going to talk about a lot of different things, about different parts of the body as it relates to cosmetic surgery. One of the things that we see very commonly now, and it's very popular, is doing reconstruction after massive weight loss. Now this may be weight loss because of diet and exercise, or it might be the result of post-bariatric surgery. One of the areas of concern in women that have lost 50, 60, 70 pounds is that of the inner thigh skin. I recently read an article in the Plastic Surgery Journal where they talked about complication rates in people who undergo massive weight loss and then have a concomitant inner thigh lift. Now basically there are two types of thigh lift. There's one that's transverse along the inguinal crease and one that's vertical, extending from the inguinal area to the knee. And what they found was that the complication rate was about 40–45% of people who had a transverse thigh lift. Those that had a vertical, that is one from the knee to the inguinal region, the complication rate was as high as 76%. Now what were some of these complications? Might be wound dehiscence or separation of the wound, it might be a collection of fluid, might be a collection of blood from bleeding post-op because the patient got too active too soon, or it might even be infection. So I think it's important that should somebody consider undergoing a thigh lift post-weight loss, that you go to a board-certified plastic surgeon, that you're in maximum tip-top shape to get it done. But at the end of the day, when you're doing lifting, whether it's a thigh lift, a tummy tuck, a breast lift, the only way to get rid of loose skin is to go ahead and do an excision. And certainly a thigh lift can accomplish that in a very effective way. Another thing that recently came out, I read an interesting article about baggy eyelids. I see women in their 20s that have baggy eyelids, and I think a lot of times this is congenital. And I hear the comments, my father had it, my mother had it, now I've got it. And in this day and age, we're all looking for ways to do something to correct a perceived deformity non-surgically. Well, help may be on the way. There's a company that is coming out with a product called XAF5. That's the code name now. And what it is, it's a cream ointment that you apply to the lower lid to improve the appearance of the lid. And in preliminary clinical studies, 75–85% of people have had an improvement in their overall appearance and are satisfied with the results. So hope may be on the way, so as we're putting on our aftershave or our evening makeup to go out, we might want to put a little cream on to get rid of that baggy under eyelid skin or sagging that occurs so commonly. Another thing has to do with breast implants and breast cancer. I think so many times in my practice, patients will ask me, Dr. Brueck, is there an increased risk of breast cancer with implants? My mother had breast cancer, whatever. And there was a recent study that I read. It came out of Amsterdam. And what they did was they did an analysis of the English literature. They did what they call a meta-analysis. Now don't ask me what it is. I'm not a statistician. But it involves 17 different studies of individuals who underwent breast augmentation. What they found in doing this complete analysis of all these studies was that there was not an increase in the incidence of breast cancer. In fact, there's actually a decreased incidence of breast cancer. So now the question remains, is this decrease in breast cancer due to a mechanical effect, i.e. the implant is put under the breast tissue in all circumstances, so the breast tissue is closer to the skin, i.e. more readily palpable? Or is there some kind of stimulation of the immune system that allows the immune system to ward off of breast cancer? More studies need to be done, but it's interesting, and I think it lays to rest the idea that implants can cause breast cancer. So indeed they don't, and so if anything, they may even have an improvement in terms of the incidence of breast cancer. One of the interesting things was there was a physician in Essex, England, I believe it was a Dr. Farmer, who did a study of over 1,000 patients who had what they call polyurethane breast implant. Now these are implants that I used many, many years ago in the United States, and at the time they were called MEM, M-E-M-E, MEM implant. and they were a gel implant. They had a polyurethane coat. And what he found in over 1,000 of these individuals who had polyurethane implants, that none of them had a class 3 or class 4 Baker capsular contracture. A 3 or 4 means a very firm, hard breast. So this was over 1,000, which is pretty impressive. And I just thought I would pass that on. Another thing is, as we move forward, there's always new technology. And I think when we embrace new technology, bringing it into the practice, the question is, how satisfying, how effective is that new technology in delivering the results it's intended to deliver? The number one technology that had the highest overall satisfaction rate was in excess of 90%, and it was the mirror dry, which is something that I do in my office for excessive underarm sweating. 90% satisfaction rate. The next highest one was laser hair removal, and 71% of patients said they were pleased with the results of laser hair removal. Botox was 70%. Cool Sculpt, freezing of fat, was 68%. Alt therapy was 69%. IPL, intense pulse light therapy, was 59%. And I think what's important to understand is when you're contemplating going and getting some non-surgical procedure performed, that your expectations meet the reality of what that technology can deliver. So many times, for example, I'll see people that come in that have had cool sculpting where they were disappointed, when in reality what they really needed to have done was liposuction. So I don't think it's a failure of the technology, it's, I think, a mismatch between patient expectations and what that technology can deliver. We're also going to talk a little bit about statistics. We all like to see statistics and what's exciting, what's new, what's hot, what's cold. And we just now got the 2014 statistics from the Aesthetic Society from 2014. And the number one surgical procedure performed in 2014 was liposuction. Over 342,000 procedures were performed. Now, many times when we do liposuction, it's not just one area. For example, we may suction the flanks or the backside, the saddlebags or hip areas, as well as the tummy. So liposuction was the number one, followed by breast augmentation. There were slightly over 286,000 breast implant procedures performed last year. This does not include breast reconstruction, simply augmentation, which interestingly enough is a little down from the year before. And I think that's due to the fact that once silicone implants came back on the market, they became extremely popular, and there was a pent-up demand for silicone implant, and now we've met that demand. But still, breast augmentation is an extremely popular procedure, has a high degree of satisfaction. After that was eyelid surgery, that is excessive skin on the upper eyelids and or lower lids. We call that a blepharoplasty. Now, what's interesting about upper eyelid surgery, I call it a twofer. Now, what do I mean by a twofer? Twofer means that it has a medical benefit. You can actually see better, and there's a cosmetic benefit in that you look better. So we call it a twofer. Very similar to a woman who has a breast reduction. She'll have tender, painful, large breasts. You do a breast reduction, they're smaller, more shapely, and physically she feels better. So we call it a twofer. At least that's what I call it. Somebody else may have another name for it, but that's what I call it. The other fourth most popular procedure was, if you want to gather a guess, was tummy tucks. We see more and more women undergoing tummy tucks in conjunction with other procedures. For example, a woman may want to have some liposuction done and a tummy tuck at the same time. And why do we do a tummy tuck? There's excess skin, there's stretch marks, there's weak abdominal wall. Definitely a home run, and we see that very, very commonly. So now the question is, what are some of the more common non-surgical procedures that we perform? And obviously at the top of the list would be the Botox. I think there were in excess of 3.5 million Botox, Dysport procedures performed last year. Following that, hyaluronic acids, Restylane, Juvederm, Silk, things of that sort. There were approximately 1.7 million injections of hyaluronic acids done. Peels were about 500,000, microdermabrasions 420, 430,000. So they were very, very, very common non-surgical procedures. And I think it's important to understand when you get a non-surgical procedure, again it goes back to what we were talking about earlier about technology, that you don't exceed the realization of what that procedure product can deliver. And I think a lot of times people expect more and the results are less than ideal, and so they're disappointed. So those are some of the more common non-surgical procedures performed in 2014. Now, a new product that may loom on the horizon, may come to the forefront the next year or two, that may hold promise for non-surgical fat reduction. It's Lipo202. What it is, it's actually an asthma drug. The technical term is salmeterol xanafate. Now, I may not be pronouncing it correctly, but that's the best I can do. But it's an asthma drug that has been shown to be effective in decreasing soft tissue mass, i.e. fat. Now, what this is involving is a series of injections with a small 30-gauge needle, and the injections are spaced about 4 centimeters apart, and you do the injections weekly for approximately 8 weeks. And what they found that a lot of the people in the phase 2 clinical trials actually saw a decrease in the amount of abdominal fat. Now, that has to be quantified, and again, patient satisfaction surveys need to be performed to see if it's efficacious to the point where people are satisfied and happy. So there may be help on the way to go ahead and get some abdominal fat or fat in other areas injected away. But hope also is here in reality right now today with a new product from Kythera. The code name for this product was ATX-101, and it now recently received FDA approval, and we should be offering it soon. What it involves is the injection of deoxycholic acid into the submental fat of the neck. Many times young people will come in, they'll have excessive amounts of soft tissue in the neck area, excess fatty tissue. And so with Kythera, you do a series of injections of this product to help melt the fat. You do them every 3 to 4 weeks. The downside is you may get some bruising, some redness, some swelling, and you may need to have 3, 4, 5 injections into the area to melt the fat. Now, interestingly enough, I would say about 10, 12 years ago, I did a young lady when mesotherapy started to come on the scene who came in to see me because she had a lot of soft tissue fullness, i.e. fat, in her neck. This bothered her, she didn't like it. So we did a series of mesotherapy injections of deoxycholic acid. And after about 5 injections, it was amazing that the fat melted and went away. Now, the price she paid was she had some swelling, some redness, some tenderness after the injections, but the fat did go away. But it's also important to understand, once that fat was gone, what it revealed were platysmal bands. So you see people, as we age, we get these bands in our neck. Those are called platysmal bands. It's due to the separation of the platysma muscle. So when we eliminated that fat through the injections, that banding was now prominent and very noticeable. In addition to the fact that she had all this excess loose skin. So when you go ahead and do something like Kythera to go ahead and eliminate the fatty tissue that's in the neck or thereabouts, you have to be careful and be certain that you're not going to uncover something that may be just as bothersome. So these are the new things, some of the new things coming on the horizon, and we'll be updating you with some new things next week. And if there's anything you would like me to discuss on our What's New in Cosmetic Surgery, you certainly can go ahead and email me at rjbrueck@abodyandface.com or go to beautybybrueck.com. And one other thing that I failed to mention, and I want to mention to you, We have a new link on our website from a software company called Swivel, S-Z-W-I-V-E-L. And Swivel is a new software tool link on our website where you can get a virtual consult. So basically you can upload some pictures, a little history, and I can give you some preliminary information as to what might be possible through plastic surgery or cosmetic surgery. However, it's important to understand this is not a definitive recommendation. It's a preliminary. In the end, whether I or someone else does the surgery, you have to be present physically so the doctor can examine you and talk to you, look at your complete physical, look at the different areas of the body that you're interested in. But at the same time, this may go ahead and provide the physician and or the prospective patient with a little preliminary information which will make the consult a little more meaningful. So if you go to our website, Beauty by Brueck, you'll see that link to Zwivel, Z-W-I-V-E-L. Again, have a wonderful week. We thank you for listening to us, and we look forward to seeing you again next week.